So welcome everyone. I want to reiterate that we really want you to interact with us. So we're going to give our panel an opportunity to give you a brief presentation on their work and opportunity. In particular for this panel, we are focusing on our REACH project, which Peggy has already touched on at this moment. And again, we think about questions you really want to ask us or ask the prior panel, and use those index cards. And actually, I have two volunteers on the far right who can pick them up on you. And if you guys could raise your hands on the far right, raise your hands. So they will pick up your cards, making sure they're on top of it. I have my daughter and her best friend here helping us out today. So, and then also a quick reminder that we do have our commitment signs. So please take some time today to sign those and make your commitment to smart-free housing. So, without further ado, I will actually start off with Antonio Limons, who is the Senior Vice President of Strategic Initiatives at FAME Corporation, who will give you an overview of their interaction with the REACH project.
Good morning. Good morning. So we're very excited first to be a part of the panel. And we've been doing this work in the community for quite some time. We are honored to be working with SAFE. And one of the things Pastor Boyd spoke to earlier is we, in 2016, took all of our properties, which is 320 units, 1,200 residents, smoke-free. And as a result of that effort, we were able to get the kind of media attention that showed it was possible, and this was a voluntary policy, to show that A, it was possible when a group of people came together, as a result of the surveying that we did. So we didn't just decide at the administrative level, which we could have, that we're going to be smoke-free. We, as a part of our work with UCLA, used our properties as an access point for getting public opinion from the residents. And as a result of the outcomes of that survey data, we were able to see where the residents were and what their tolerance was in moving forward with the policy. And it was overwhelmingly supportive. Of course, there were those individuals who were opposed, and we were able to educate those individuals and support those individuals both in changing their perspective, but also offering support, because a lot of times the opposition was coming from residents who either smoked or were loved ones of people who smoked and realized the kind of disruption going smoke-free would cause in their household. So what we were able to do about a year ago is we did a Where Are We Now assessment. So not only did we survey before making the policy change, we also a year later went and spoke with all of the residents. A lot of our residents actually physically come to our property, our corporate property on Adams and Western, and pay their rent. So it made it very easy for us to access them. So when they came to pay their rent, we gave them the survey, and they were able to complete that survey. And we had, I think, about 87 or 89% response rate on the survey, which was tremendous. And people were very happy a year out. And we really paid close attention to those individuals who were a part of the opposition initially to see what kind of movement we had made there, because that was really important. It's like when when you're preaching to the choir and people are already on board, I mean, you can take it as a success. But in terms of the effort as it relates to the education, the outreach, what kind of movement was really made, and we saw a tremendous increase as well in the support change from that part of the population also. Some of the same things that the councilman had talked about being challenges we have faced, enforcement, marijuana laws, recent marijuana laws, that's usually the big one right now. We have not had a lot of enforcement problems actually, very few. I'm always in communication with our housing unit, the property managers, et cetera. So we haven't had so many complaints, but what we have had is a challenge in resolving complaints. Because you'll have a situation where, because we actually have a program where we step them through, I think it's 3 warnings and actual eviction. So I mean, we're pretty serious about our policy, and we move quickly and swiftly in terms of addressing violators. But we also want to do that in a loving, supportive way. But what we have found is that in the small number of cases where we've had kind of chronic violators, being able to educate them, get them in the cessation work, which is also work that we do in cooperation with our relationship with SAFE and UCLA and the American Lung Association. We're one of a handful of licensees who actually provide cessation programming as well. Really encouraging those individuals to get into our cessation clinics so that what they're feeling is we're not trying to be the police, we're really wanting to support them in their health as well. And when we can get the resident to understand that that's the perspective that we're coming from, as opposed to having this be a conflict between residents who live next door to each other and have to see each other every day, and then now we become referees of that relationship. So we've been able to be very successful in that regard. Some of the other highlights that I wanted to speak to was the collaborations. What we found is, having done the work ourselves, is a little easy because we controlled the properties, we made the decision, so it put us in somewhat of an advantage. But we also wanted to share what we learned in our process with other landlords. And so in our work in terms of educating and being part of the outreach and education with AGLA in particular, that partnership proved to be very successful in working. We were able to actually reach large numbers of landlords at one time, so usually anywhere from 20 to 40 at a meeting like that. And we were really surprised at the level of receptivity. There was significant receptivity from many of the landlords that we interface with, and it was just a matter of education and really understanding how do we get it done. So what this has really shown us in the work that we've been doing this work now probably about eight years, a little over 8 years, and getting community involved. One of the other things that we were successful at is training 20 community members who actually represent the message and work in their own properties, work in their own communities. We had a big luncheon, which UCLA was also present at, to acknowledge them. We really wanted to acknowledge their efforts, and many of those individuals moved over into getting trained by the American Lung Association to do the cessation work as well. So really involving the community, being compassionate in the effort, has been some of the things that we feel have been really important to our success. And we're proud to be a part of this initiative and look forward to our continued involvement.
Thanks, Antonio, so much. Like I said, please make sure to jot down your questions. We'll have an opportunity to have an answering question period. So now I'm going to hand it over to Benjamin Torres. He's the president and CEO of Community Development Technology Center, also known as CD Tech.
Good morning. Buenos dias. I want to thank, first of all, I want to have the opportunity to thank the team that did this work. I'm up here representing the organization, but to be really quite frank and honest, Christine Williams, Stephen Love, and Susana Coracero were the CD Tech team that have been working on this project for 4 years. So I want to first of all thank them, along with the Public Ally interns, as well as the Latina immigrant leaders and other interns that we involved from the South LA community in this project. It would be unfair for me to take all the credit because I have the title. So I just wanted to be keep it 100 and transparent in that sense. And second of all, when we got asked to participate, why would CD Tech get involved in this project? This is something that focused on health and smoke. And when we reviewed it as a team, we realized, first of all, we're subject matter experts in the South LA area, Council District 8 and 9. We knew the community very well. The majority of our staff and our participants come from this area, so we felt it was important for them to get a chance to engage in this piece. The other thing is you got to look at this from an economics perspective. We are an economic development organization focused on trying to create pathways that move folks out of poverty, not move people out of South LA, but move folks out of poverty, which means improving South LA so that people can stay in South LA, primarily black and brown folks who make up the majority of South LA. And so because of that, we have to look at what are the economic conditions that foster this environment. And so the over-concentration of liquor stores and supermarket and retailers who provide tobacco products in our community is something that's very concerning to us. And so that was a big piece. The amount of money that people spend monthly on tobacco products and its impact on the entire family is another piece that's important for us. The environmental factors and the health conditions, of course, the over-concentration negative health outcomes that exist in South LA, both from access to health resources, to the air we breathe, right, to the kind of the social determinants of health that exist in our community, showed that there was something that was critical here, that there was an intersectionality, as you can say, that there's a relationship between the economics, health, and the environment. And the other thing that we felt was important was that there's a civic component to this, a civic engagement, a civic democracy piece, that when people do not talk to each other in neighborhoods, in apartment buildings, around these issues, we're really destroying the social fabric that for many years allowed African American families to stay together in South LA and survive and thrive in their own form of economic development opportunities. And that has been a space where Latino immigrants and US born Latinos to be able to communicate with each other and maintain a cultural sense of integrity in the community. So when you don't talk about these issues that are affecting your health, that are affecting your quality of life, it affects the democratic process in many ways. And so for those reasons, we chose to get involved. And then finally, the last thing I'll say why we got involved is because any opportunity we have to give people professional development opportunities in South LA is critical. So learning how to knock on doors, learning how to engage residents, learning how to do surveys, learning how to take data, learning how to analyze data is a critical part of the kind of skills that we need in this 21st century workforce. And for folks that we engage in the process, we thought that these would be beneficial. And at the end of the day, of course, we know it's a good cause. Let's be real, folks, this is about race, class, and immigration status, and let's just be very transparent about it. And for those reasons, we wanted to make sure that those most affected by these conditions were directly engaged in the process. So I'll give you some of the kind of data, statistics of the work that we did, just to get a sense of the scope of the work over the last 4 years. We conducted hotspots and surveys of 700 residents in CD Council District 8 and Council District 9. We conducted about 36 education presentations and tabling at health fairs to make sure we got the word out around this subject matter. We did a lot of one-on-one education, reaching over 2,500 residents. That's a big number, 2,500 residents. That means 2,500 potential families that are being impacted. We also identified 800 properties with some form of smoke-free policies representing 32,000 units of housing. We supported trade shows. We talked to folks who were also in favor of changing and creating some sort of local policy related to their units. We produced 4 videos and 2 op-eds. We talked about this issue of democratic participation, so getting your voice out is critical. So the fact that you had people who are being affected by this produce op-eds, as you can imagine, when you think about the populations we work with, these are folks who never get their voice heard, they never get engaged. And so these were important pieces of the work that we conducted in terms of some of the mechanics. In terms of some of the surveying and education, and Peggy mentioned some of the data, so I won't get into the specifics, but I will say that there were a couple more of the impacts around this work. As we talked to folks across the communities, they talked to us about their heart and lung diseases issues that they were dealing with as a result of secondhand smoke and drifting smoke in their living space. Some have tried to confront managers about these, but going back to the issue around housing availability, many times property managers would tell them, you know what, if you don't like it, just move out. Well, you try telling that to an African American family in Council District 8. Where are they going to go? Who's going to house them? You know, the gentrification issues that are starting to impact South LA are so dramatic that even in areas where you would never consider an issue for housing for African Americans, like the jungles, even areas like that are being challenged by people not being able to move in. So when you tell somebody just simply move out if you don't like it, that's not only a disrespectful thing, but it's unrealistic of the economic and housing conditions that exist in our communities today. Very important thing that we need to continue to figure out and work through. Other folks felt really excited about the fact that you had the UCLA, the powerful institution of learning, asking them what they thought about issues, what they care, how this was affecting them. Many people began to articulate the fact that they had more issues that they wanted to talk about, right? We have other conditions, you know, and so around job creation. And so how did that impact, how could they talk more about those kind of issues? So as you can imagine, when someone comes to your front door or sees you at a hotspot and talks to you and engages you in conversation, folks begin to open up. We need that in our society. And so this project presented not only the opportunity to talk about smoke and its impact, but an opportunity for people to share their issues and kind of create a sense of community across the board. And I thought that was an important thing. The interesting thing was that, as I mentioned, the majority of non-smokers and smokers expressed a desire to have access to smoke-free housing. There's unequal protection. Clearly, there's unequal protection. The major findings was that as gentrification impacts these low-income neighborhoods, the higher-end market rate properties are the ones that have instituted policies. Only in rare instances have owners of low-cost housing units implemented policies. So this is the issue of race and class and immigration status. The threat of being deported and your ability to say something to your property manager was something that was also a common finding. So I'm gonna wrap up. I think in terms of the long-term impact, as I mentioned earlier, it allowed for our staff to really engage with residents in a deep and meaningful way, in a way that CD Tech is really well known for. And then the other thing that was, we created a pathway for professional development careers in the health sector for Latina immigrant leaders in South LA, for young high school folks to be exposed to this who are doing internships with us, for our community college students at LA Trade Tech College that take classes in our community planning and economic development department. They were directly infused into the community. They developed these one-on-one, these collective engagement opportunities and skills, and we think that'll go a long way to addressing some of the larger fundamental issues related to what's going on in communities like South Los Angeles throughout the city. So with that, I want to just say, I want to thank the partnership and the collaborative for continuing to engage in this and for allowing us to contribute our part in that process to move towards a more just, equitable, and healthy Los Angeles. So thank you very much.
Thanks, Benny. So now I would like to hand it over to Dee Trevelyan, our landlord advisor with the Apartment Association of Greater Los Angeles.
Good late morning, everyone. Can't keep up with the time. Okay, my name is Dee. I work with the Apartment Association of Greater Los Angeles. We service just a little over 10,000 owner members. We assist them with operational advice, discounted tenant screening. Our biggest benefit for owner members within Greater Los Angeles would be how heavily politically involved we are for owners' rights. So this collaboration with UCLA Smoke-Free Housing has really basically connected the owners with the Smoke-Free Initiative. So, you know, I mean, without that connection, you know, how else would owners be educated on the issues with smoke-free housing or even believe that they can remedy that, you know, especially with strict RSO, which is rent control ordinance laws. Excuse me. So AGLA was lucky enough to participate in the training given by Smoke-Free Housing where we actually carried out a role-playing segment, and it was a hit. It was a hit for staff, and it really provided understanding as to why the initiative was so important. UCLA Smoke-Free Housing has really been the sounding board, and the entire initiative, not just that segment of it, but it's really been a sounding board for public health awareness, shining light once again to the terrible effects of secondhand smoking. I'm an 80s baby, so I don't know if you remember back when, you know, the media was huge with the secondhand smoke kills, and somehow that kind of just vanished or, you know, went away. But they've done a good job in due diligence in bringing that awareness back. I'd also like to say that the partnership really created a resource for our members. A lot of our members really desire to transfer over to smoke-free policies, but they don't know exactly how. So with this partnership, we actually have created a resource for them. We get them connected, and their desire to adopt a smoke-free housing policy, and exactly how to do that, you know, respecting RSO guidelines is shared with them. And you know, we've just been inspired with this collaboration, with the partnership. We've added more educational seminars focusing on this topic. We recently had an Apartments Up in Smoke seminar that was a huge success. We've had people calling the office wanting to get that back on the calendar. So it's in high demand, and it was a hit for our members. So we feel grateful and thankful that the people of smoke-free housing, anyone who's involved, is as passionate as they are and as diligent as they are to just create awareness about how important it is for smoke-free housing to be implemented in especially Los Angeles County, seeing that we have an F rating. So that doesn't sound too good. But as I said, the Apartment Association is really grateful. We appreciate any partnership that we can put together where we are basically educating our members and creating resources, which we have. And it's a great thing. And I'm happy that I'm here today to speak on their behalf.
Thank you. So as you can see here, and I'll do a presentation of our project, but we have a wide array of partners who have really played a key role in really giving us what's kind of an idea of what's going on the ground, and that was really key. As Peggy mentioned earlier, doing these key informant interviews of key organizations that are working in these areas and looking at the challenges and areas of looking at how do we preserve tenancies while still providing protection from secondhand smoke. So I have a little presentation. So we are basically about to end our 4th year of our REACH funding. And this event is really a culmination of that funding, but it really is really a beginning. A lot of the work that has been done has been really, as John mentioned, a foundation for what are the next steps. So as part of the project, we have identified over 70,000 units that are within properties that have some type of non-smoking provision. I say that because in some of the properties, we've accounted for the units, but the properties might only have smoke-free common areas, for example, or they might have entirely smoke-free properties. So it really kind of varies, but these are the units that comprise basically where there are some type of units that are smoke-free and within the 6 council districts that are mentioned here. We have trained, I have 30 here, but I think we've trained over 40 community members to be opinion leaders on this topic. And Benny mentioned that. And actually we have a lot of our Latina leaders here today who have been really played a key role in going into the community, talking to other members, and really trying to expand this, because I think many times this issue has stayed within the public health arena or within people who are being injured from secondhand smoke, and we've had an opportunity to really expand on that, where we're engaging organizations that are much more diversified and community members that many times believe that living in an apartment meant that they had to be exposed to secondhand smoke. As part of this project, we created the Smoke-Free Apartments Los Angeles initiative, which you have seen the little girl, and that's part of that imaging. And it has allowed us an opportunity to provide the data that was collected by our partners, to provide further information, look at resources that applies to tenants, to landlords, and people who smoke. And that really has been key, because we want to make sure that, and looking at this area, that we're addressing not just the people who are being injured, but also those that smoke, because they too are victims in this issue. So again, partnerships, that has been key, and you're seeing it from our partners here today. We have an extended partnership membership, and we are glad to share that they are still active and committed to be a part of this issue, even beyond the ending of the REACH funding. In addition, we've engaged the Los Angeles Housing Community Investment Department to issue a smoke-free guideline that clarifies that housing providers can make their properties smoke-free, and how they can do that within rent-controlled properties. And we will have a presentation later today on that. But again, that was key. It came from our data. The landlords have misinformation as to how do they implement these policies, especially in lieu of rent-controlled regulations. So this document has been disseminated to over 1,000 housing providers, and as Dee mentioned, they're being done at housing seminars, they're being done at trade show events. We've had our partners disseminate that information as well. So as in looking at the guidelines and kind of really trying to establish, where exactly policies are within the properties that we have identified, we have asked our partners to do a follow-up within the landlords that have some type of smoke-free property, and we asked them about the guidelines, and over 82% were aware that the guidelines had been issued. But as part of that conversation, we had an opportunity to ask them about what are some of the challenges that they're facing when they have non-smoking provisions. And some of the things that they shared was that not having it in the lease can definitely be a challenge. And obviously because of rent control, many times it means that some of their tenants have lease provisions in their contracts, some of them do not. So that does create some confusion, especially when you have really long-term residents that have been there and might have been smoking the entire time. So kind of looking at that, and Antonio mentioned that can be challenging in terms of like how do you resolve when there are issues or challenges around enforcing those policies that are in place now. Oh my slides are up again. There you can see that over 80% of people that are aware of the guidelines. In addition, so our evaluation team did a deep analysis of what are the cost savings and productivity savings when smoke-free housing policies are implemented. So the estimation is that there's a savings of $4,800 to $5,200 per year, basically on an individual basis. When converted into a kind of an area such as Service Planning Area 6, that looks at about $20 to $22 million of healthcare cost savings and lost productivity a year. So again, having smoke-free housing, it's definitely going to not only benefit tenants, housing providers, but I think the society as a whole. Another area that we have been focusing on is tobacco cessation. And as part of our key informant interviews, it was really made clear that if you are going to have smoke-free housing, that people who smoke need to have resources. And we found that those resources were limited, especially in South LA. And so we have just started a tobacco cessation network. And again, it's in the beginning stages, but we have had an opportunity to partner with the Lung Association and have trained over 30 organizations on the Freedom from Smoking curriculum. And we have 3 licensees, which includes FAME, Wellness Center, Venice Family Clinic, and we're in the works with USC/Cedars. And again, this has been in response to that lack of resources, but they're also looking at the fact that this is a well-needed resource that as we regulate smoke-free housing, people who smoke need to have some way of dealing with how to quit, especially since it can be so difficult to quit. And just to wrap up, that we're here today to really express that there's a level of readiness that this project has allowed us. Our continued efforts to increase access to smoke-free living through education, information, capacity building. Again, you've heard that here today, right? That this really has expanded beyond smoke-free housing efforts, and that many of our partners have been able to utilize this to bridge in other partners themselves and to give them additional tools that they can utilize for their everyday lives or future professional practices. For us personally, the UCLA Center for Health Policy Research is currently working with the LA County Department of Public Health to continue surveying across the entire city of Los Angeles, looking at tenants and what are their responses at this area, continuing to survey landlords as well. And again, as you're hearing, there's still a need for this information to go out, and this is just really the first beginning steps at that. So we are now open for questions. So if you have any cards for any of our panelists now or for our prior panel, please pass those over. Then we have a couple people getting them over. Then we'll have our mic people come up to the mics.
So we have one question, and it's from the first panel, and it says, it's about enforcement. It's about enforcement, and it says, can you discuss enforcement issues? What are the best practices? And what should be avoided? Guess this is something for Esther.
Pasadena has an enforcement policy, and I believe that somebody from Pasadena will be here speaking later. City of Berkeley, a city with rent control, passed a law in 2013 which requires no smoking in all apartments and condominiums, and they enforce it. Their enforcement is landlords are supposed to give all new tenants a no smoking lease. Existing tenants who may have been people who smoke are required to comply with the law. If people are smoking, The people who are suffering are encouraged to contact the city. The city is enforcing. Many cities are not enforcing, unfortunately. And if two people in the same building complain about the same person, the city takes action. I believe it's a fine. And I'm hoping somebody will be here from Northern California who can talk more about Berkeley.
So we will have a presentation later on the agenda that will address issues of examples of enforcement and implementation practices.
Great. We have one more question. What's the difference of smoking tobacco and marijuana? That's a big one. Oh, we got Esther here now.
Sorry, there isn't any difference. The state of California has found that marijuana smoke contains 33 of the same dangerous chemicals as tobacco smoke and has placed it on the Prop 65 list of substances that cause cancer. One of the things that we've got to remember is that because of the federal ban on marijuana, there has not been any opportunity or much opportunity to study it scientifically. And all of the information about how smoking marijuana has helped people, that's all anecdotal. And if somebody has cancer and they're going to smoke marijuana to help them, that's kind of crazy. And one of the problems we have is trying to get that information out to the general public. Thank you.
Thanks, Esther. And again, we will have we will have a panel that would address some of those issues. For the REACH project, we talked about smoke is smoke, whether it came from tobacco or marijuana or e-cigarettes, and we've shared with housing providers sample leases that in definitions has included that. And again, we'll talk about more about challenges in that area, but definitely something that that needs to be addressed, and it is an issue of concern.
The next question says, as smoke-free housing for all moves forward, how can you protect users from evictions? With that being said, how can we protect public places such as parks? Because it is believed that the smoking out of park is safer or the next best thing.
So I'll address part of that. So remember, one of the key things with our project was that evictions should not be the first plan of action. This is about information and education. And so when looking at this issue, looking at how do we preserve tenancy, one in the city of LA, the rent control law does not allow changes to the lease once it's been signed, which that actually allows a protection for these tenants, which can work both ways, right? It can also work where we've had some of our opinion leaders talk about the fact that they're complaining that an older resident that's been there for a few years does smoke, and therefore there's protections there. But on the flip side, again, it could work the other way. The thing here is that, again, the landlords, and maybe Dee could add to this, that landlords are not in the business of evicting, and we've gotten that across the board. What's important is to look at these lease contracts, and that people are made aware of what exactly are the rules that are in place. In order to provide those protections. And I don't know if Dee wants to add anything to that.
Yeah, no, there definitely is a common misconception that landlords are just pro-evict, and they're just so gung-ho to evict a tenant when that couldn't be any further from the truth. A lot of our owners, and I think owners in general, really don't want to have to deal with evictions because it's such a costly process. It requires a lot of hours. It's very time-consuming. So I think eviction is the furthest thing from their mind, and they try to remedy that. Any issue, they try to remedy without eviction even in the forefront. So that's a common misconception. Eviction usually is the furthest thing from an owner's mind. And I don't really know where that comes from, but yeah, it can be pretty expensive and it's time consuming. So they typically do not want to go that route.
Yes. Next question, which kind of touches on that same one. Can you comment on some of the benefits to landlords that go smoke-free, such as reducing property damage and costs from smoke and fire?
So I can. One of the biggest benefits is that it kind of goes into fair housing laws, is that if there is an issue with a tenant, you have to basically make a reasonable accommodation. And if you're dealing with someone who has issues with maybe asthma or anything like that, you are required as an owner to make a reasonable accommodation. So one of the multiple benefits would be basically trying to adopt, like I said, a smoke-free policy so you don't have to deal with that later on. And, with strict RSO guidelines, it kind of makes it difficult, but there is a way. And grandfathering in a smoke-free policy is probably the best option.
And if I could just add, there are insurance companies that are providing discounts for properties that have gone entirely smoke-free. Many times they require copies of leases, and a company that have been working with is, and I'm blanking.
CIG?
CIG, yes, thank you, CIG. And again, it's a 10% discount that they are willing to provide on that. And then just looking at overall, again, a lot of this is about informing these housing providers on that. I talked about some of the cost savings. If you have healthier tenants, they're able to work, they're able to pay their rents. So it creates a healthier living environment across the board. So really looking at the bigger picture of the cost savings that it can lead to housing providers, as well as the general community as a whole.
All right, the next question is how to help people that are being exposed to secondhand smoke in their apartments to not have fear to speak to the landlords about it.
That's very difficult. How many here are working with tenants? Okay, so there's ¿Quién trabaja con inquilinos? Okay. This has been a challenge. I know even when we're talking to landlords about, how do I help these residents that are having a problem with secondhand smoke, right? Because many times they might go to the manager or the landlord, and that's if they go, because our data shows that only 19% of tenants actually complain to the landlord or the manager. And then if they do, they complain and they want the landlord to handle it all. After that, they back off because they are fearful that retaliation, there might be an immigration status situation where they don't want to come forward. And that can definitely tie the housing provider's hands, because if they are trying to go and take legal action, it ends up being their word against the other tenants. So I think a lot of it has been just empowering them at least to start those conversations with those housing providers, so that at least everyone's on an equal playing field there.
So next question, and then just reminding folks, put your cards up if you want us to grab your card and we'll read your question. Is about grandfathering and grandfathering in of smokers' rights. So what happens if you are a resident, you may be disabled, you may have signed a lease that said it was smoke-free, your neighbor's smoking, you can't leave, what do you do?
That's really a worst case scenario. Do you want to address it, Esther, since you're over there?
There's such a thing as a reasonable accommodation under fair housing laws. It's an impossible, difficult situation under the rent control law, because the rent control law is really in conflict in this kind of situation. You can try to convince the landlord to help. Most of the time, I've discovered landlords won't. What we show with this question is how important it is to have a law. That's why we have to have a law, because there's no good answer for this.
And to follow up, sorry, so then in the case where you have a neighbor that is grandfathered in, is there any action you can take? No. The answer was no.
Yeah, if they smoke, and especially in a rent-controlled property, the options are very limited. We have advised housing providers that, for example, they try to negotiate with the person smoking. Well, maybe they'll come in there and refurbish their apartments, get everything painted, new drapes, new carpets, and as part of that exchange, they sign a non-smoking lease provision with that agreement not to smoke. But again, there's no requirement for them to do it. The landlord cannot force them to do it, and that is part of the rent control protections. But it's an option. They would have to work with the landlord, and that's on a case-by-case basis. And then we have time just for one more question.
This is more of a comment, I would say. It says that though it's very important that we address tobacco smoke, she believes that it's important marijuana to be added to this campaign because even though we don't know much about the dangers or its medical use, it does create a hassle for people, or it bothers people where they live as well.
And again, thank you for that comment. So we will be looking at that issue because it's definitely an area that I think all of us as a whole are trying to figure out. Councilmember Koretz brought it up today in his speech as well today. So it's an area that we're all going to be looking at, and that I'm glad we have all of us here that we can talk about. We have one more.
Yeah.
Is it a question or a comment?
It's both in a way.
Let's make it quick.
It says hold on. It's a question for all of you guys up there. How are we gonna do to have these rules of places adopting smoke-free rules, and how can we do it so the owners of the places accept these rules?
Whether they accept the smoke-free housing rules.
Mm-hmm.
You want to start off, Dee?
I just think that regardless if you're an owner or a tenant, you're responsible to have your voice being heard. So participating in events like this, going to City Hall, writing letters to your local assemblyman, council member, whoever it may be, we just have to bring awareness, because without, educating or making noise about any specific topic, no one is aware. People who are actually lawmakers who are able to make changes, they may not know. So just making a big fuss, letting your voice be heard, being present, it's really your responsibility. And that's, I think, the only way we can remedy it for both ends, tenants and owners alike.
And just to add, so the smoke-free housing guidelines that the LA Housing Department put together is one of those efforts that we've put together so that they are informed of how to go about implementing these provisions. And again, partnering with all of you in terms of dissemination, right? We've partnered with AGLA, we've partnered with several other apartment associations, but we still obviously are not reaching out to all of the housing providers. So that is key in terms of getting them informed and feeling empowered to implement these provisions, especially as there are new products coming on the market. So I'm gonna stop here, and I'm gonna thank our panelists for joining us here today. Again, if you have additional questions, please write them down. If we did not answer them during this session, we can answer them during the next panel. And actually, I am going to invite Lindsay Freitas, our moderator. She is the Senior Director of the Tobacco Control and Lung Health American Lung Association in California Center for Tobacco Policy and Organizing.